Hey guys, well, good morning. It's good morning here. Welcome back to No Filters. I know that it has been a while since I have done a video blog, but there's been a lot going on with me and some transitions and a lot of introspection, which I think is good for everyone to do at times. It's good to just take a moment to sit back and pause and think about what's going on in the world and how you fit into that. So I think it was healthy introspection. Um, Not only that, but when I do the No Filters blogs, I usually like to think about what it is that I'm going to talk about in upcoming blog discussions. And ironically, what I found is a lot of the times it's very sporadic and spontaneous. Um, Usually something will happen with me, or I experience something, or I experience something with another individual, and I'm then prompted to want to do a video blog. And I'm really excited when it comes time to talk to you guys, and when I have that aha moment, as Oprah Winfrey would probably say. Um, with this particular discussion, I want to make it two parts. I want to talk a little bit about STDs and kind of do a one-on-one to dispel a lot of misconceptions about some sexually transmitted diseases. And the next part I want to talk about is a study that was released called the Partner Study, and some of my frustrations with how HIV positive men are taking that information and making it applicable to their own lives. So let's start off with STDs. I'm not going to go through each and every single STD. I'm just only going to talk about some of the more popular ones. Um, it is my hope that you have a primary care physician and that you seek out your primary care physician to verify anything that I may say to you, and also to just have on hand to ask questions to at your leisure. For my ladies, I hope that you have an OBGYN specialist, obstetrics and gynecology. There are some differences when we're talking about STDs and the anatomy and physiology of males and females as far as the responses that they give to STDs. They're sometimes very different. They're not always the same as far as equivalency with males and females responses. Um, let's talk about first gonorrhea, chlamydia, and syphilis. We'll also discuss HIV. Let's do HIV first. HIV and AIDS are two completely different things. HIV is the virus that can cause AIDS. AIDS is a later diagnosis that some individuals can develop most of the time due to the body's immune system starting to lack in a healthy response to HIV. Um, and also, AIDS definition is 200 CD4 count, where we're talking about white blood cell that's less than 200 copies, and also an opportunistic infection being present as well in the body. That is what's considered an AIDS diagnosis. And no, there is no such thing as full-blown AIDS. There's no such thing. Don't say that ever. And when we're talking about HIV can be transmitted of a few ways: in contact with infected blood, contact with vaginal secretions, contact with semen, as well as contact with breast milk of an infected mother from mother to baby. Those are the ways that HIV can be transmitted. HIV can also be treated with what we call antiretrovirals. Our hopes with giving an individual or prescribing an individual antiretrovirals is that they remain adherent to their medication regimen, taking it on time as needed. And we hope that that regimen works in conjunction with the body's immune system to suppress what we call their viral load. And when that person's viral load has then become suppressed, that individual is less likely to infect another individual due to there being less amounts of the virus per volume of blood. Um, let's also go and talk about gonorrhea, chlamydia, and syphilis. All three of those STDs are bacterial STDs. They can all be transmitted. They can all be treated with antibiotics. They can also be transmitted orally, anally, as well as vaginally. All three. So if you're not using condoms when you have oral sex, or you're not using dental dams, or you're having unprotected vaginal or anal sex, you're at risk for infection for all three of these STDs. Usually, syphilis is treated with a Rocephin or Bicillin shot in the butt. Based on where you are in your stage of infection, they'll give you one shot and send you on about your way in the butt, or they'll tell you that you need to come back, which is usually the case, for 3 shots for 3 consecutive weeks in a row. So you get 3 shots in the cheeks for 3 weeks in a row. And trust me, it is not cute and it does not feel great at all. I'm speaking from experience here. And when we're talking about gonorrhea and chlamydia usually can be treated with an azithromycin prescription. They're red tablets. You swallow them and go on about your day. And they tell you to usually not be sexually active anywhere from 7 to 10 days, and don't have any new partners. When you have these new partners, or when you're becoming sexually active while you're still during the treatment phases, you can transmit the STD to someone else. And not only that, that partner can also transmit the STD back to you while you're still going through your treatment phases. So that's normally never a good case. And another two that I want to talk about is herpes and as well as hepatitis. Herpes, almost 50% of the population has. There is herpes simplex 1, waist and above, herpes simplex 2, waist and below, which we also would consider genital herpes. Herpes simplex 1, your cold sores in your mouth, on your lips, etc. Herpes simplex 2, vaginally, anally, as well as penile. Usually, herpes is treated with a valacyclovir prescription or Valtrex. Again, herpes is a virus. You cannot get rid of it. And, I just want to normalize that I have been diagnosed with herpes. It's almost something that you just need to accept the fact that when you're engaging in sexual activities, and I take that back. You could be laying in the bed naked with someone and not doing anything at all, but just touching each other's skin, and they can transmit it to you. So when you hear that somebody has herpes, please don't make a huge deal out of it. Just educate yourself, educate them if they're not educated, and move on about things in a healthy way, in educational healthy way. Yeah, you'd be surprised some of the things I've heard about herpes. It's just ridiculous. Um, the next thing I want to talk about is hepatitis. I primarily want to talk about hepatitis A, hepatitis B, and hepatitis C. When we are looking at hepatitis A, we are talking about mostly fecal matter, whether that fecal matter is from somebody not washing their hands, or you want to engage in oral, anal sex, etc. That's usually how hepatitis A is transmitted. Hepatitis A normally fights off itself as far as the body is concerned. Your body can normally rid it, and in some cases, your body can't rid it, and you need medications to help you out with that. As far as hepatitis B is concerned, hepatitis B can be transmitted through bodily secretion or through bodily fluid. So we're talking about vaginal secretions, we're talking about semen, we're talking about blood, we're talking about anything here that's coming out of the body and getting in contact with another individual. Hepatitis B as well, your body normally has a really good strong chance with a healthy immune system of fighting it off on its own. There are some cases where people also need medication to help their bodies fight off this virus. When we're talking about hepatitis C, we are talking about infection through blood. So we're talking about sharing needles as far as injection drug use is concerned. We're also talking about oral sex if there are sores there. We're also talking about anal sex if there is a presence of blood, and we're talking about vaginal sex. Now keep in mind, when we're looking at infection through blood, we're looking more so at infection from a biology perspective. So even though when you're having good sex and it's feeling really great and there's no pain or nothing, there a lot of times are microscopic traces of blood there. And when we're looking at blood, we're talking about potential risk for infection. Hepatitis C does not have a cure, and hepatitis C does not also have a vaccination, unlike A and B. If you have not been vaccinated for hepatitis A and B, I strongly suggest that you go and get those vaccinations. One is done with 2 shots, and the next one is done in a series of 3 shots, but your body loves it. So really look into that if you haven't been vaccinated yet. All of the hepatitises, A, B, and C, that I'm speaking about in particular, can be acute infection. Acute infection is normally what we would consider infection lasting up to 6 months. anytime that infection has gone beyond 6 months, we're looking at chronic infection. Chronic meaning that it can't be cured, it's inevitable, you have it, and most of the time, until there's a medical breakthrough, it's for life. Um, Now that we've gotten the STD 101 out of the way, there are 20 million other ones that are out there. I'm over exaggerating, but there are a lot of other ones out there that you should be aware of. And if you need more information about any of these STDs, I would suggest that you go to cdc.gov. The CDC is really great about updating their policies and procedures as far as, how things are transmitted, what's used to treat them, etc. Um, the next thing I want to talk about is this new study that was released, the partner study. This study was done with individuals where heterosexual and gay couples, one was positive and one was negative, which we would call serodiscordant. They're a serodiscordant couple. This study was showing how individuals who are HIV positive and on medications with that low suppression that I was talking to you about, that undetectable suppression, it's talking about how potential it is for those individuals to infect their negative partners. And so far, I mean, bravo, the study is showing that there's almost zero risk for transmission with couples who are monogamous, sleeping only with each other, where one is positive and one is negative, whether they're homosexual or heterosexual. It's showing that it's really hard to transmit the virus. Um, but where they were also seeing some differences at were where some individuals were acquiring STDs, and with those STDs, bringing them back to their partners, and their partners being able to transmit the virus that way. They primarily saw this increase in STDs with homosexual couples versus heterosexual couples. And this is the part where I get really frustrated. I have talked to some individuals who are HIV positive, some individuals who love to have raw sex, which is what we call unprotected sex. Um, and they have this misconception, oh, well, did you hear about the partner study? Did you hear about the partner study? And I'm like, yeah, the partner study is just that. It's a partner study. It's meaning that you and this other person are only having sex with each other. You're not having sex with every other Tom, Dick, and Harry. That's not the way that this study works. And the study did also mention that, there may or may not be high instances of STD transmission or HIV transmission through STDs. That is still undetermined. We have until 2017 to figure out what the final result of this study is going to be. So for an individual to take some information and try to make it applicable in the grand scheme of things, just so that they don't have to feel bad about some of the sexual activities they engage in their lives, is just completely ludicrous and ridiculous. And a lot of HIV positive men who are single that want to engage in unprotected sex with, again, every time Dick and Harry, you aren't sleeping with just that one person. You're sleeping with multiple individuals. We're talking about multiple STD transmissions and infections. And at the end of the day, it's like, who in their downright mind can actually say, oh, I'm really comfortable with having STDs. I love having STDs. I mean, even myself, I don't like to go to the doctor and the doctor says, your numbers are great and everything is fine. Oh, by the way, did you know you had X, Y, and Z? It's like, no, nobody likes that. And to be completely honest, it's quite embarrassing when you have to go back and forth to your physician for some of the same things and to get STD treatments. It's not cute at all. So I'm really frustrated with the way that a lot of HIV positive individuals are taking this. A lot of them are using it as excuses to have unprotected sex with their partners and not disclose their status, which I am completely against. I will reiterate that again. I believe in full disclosure. Maybe it's just me having a little heart here for mankind, but that's just my perspective. And a lot of them are saying, oh, you know what? He's HIV positive, I'm HIV positive, and there's nothing else that we have to worry about. As it relates to hepatitis C, we are seeing an increase in new hepatitis C infections, particularly amongst individuals who are HIV positive, more specifically amongst individuals who are homosexual and engaging in unprotected anal sex. There has not been concrete evidence to show why it is that we're seeing this, why we're seeing these elevated instances, but they're happening. So at the end of the day, protect yourselves, do what you need to do, and just don't make excuses for a lot of things just because you feel that it's okay to alter certain situations. You accept that, but don't make that a part of someone else's life. look forward to more coming from me soon. And as always, I look forward to speaking to you next time.